Good afternoon, everyone. Very happy and pleasant afternoon of this beautiful Sunday. I am Lalita Chauhan, Director of MedINCREDI. Let's wait for some time before we start this program. I just want some of our viewers join so that we can start the conversation with doctor. So I'm just waiting for some of you to join, then we will start. Meanwhile, I can share the link with other people so that people can watch it. Okay, now I can see some of our friends have joined. Welcome, Karibu Sana, if you are from Tanzania. So, good afternoon. And I must say that, as I mentioned before, also before we went to the live, even on the page I have written, why we are doing this live today. This is all about the cosmetic surgery camp, which is going to happen in Mlogenzila in month of May, 13, 14, and 15th May. So we thought this cosmetic surgery camp is going to happen in Mlogenzila in month of May, 13, 14, and 15th May. Yes, so it is all about the transformation, and everybody like transformation. Not only the girls, I think girls, ladies, gents, everyone want the transformation, and we look for other options. Sometimes we plan some diets to transform ourselves, but some things are not in our hands. Then we consider that time cosmetic surgery. We have heard about cosmetic surgery, but there are a lot of taboos that we think how it will happen, what are the side effects, so many things are in. As a layman, as a normal person, they have about the cosmetic surgery. But we have our esteemed guest, Dr. Shradha Deshpande. Herself, she is with us. So she will let us know all about the cosmetic surgery. Whatever the questions come in my mind, I will ask. Whatever the questions comes in your mind, please leave in the comments. So we will take all the questions one by one. So here I welcome Dr. Shraddha, Dr. Shraddha Deshpande. Karibu Sana.
Hi Lalita.
Good afternoon.
Hi. I hope I'm audible.
Yes, yes,
Yes.
perfect.
Yeah. And a
How
very
are you,
good
ma'am?
afternoon to all of you. Yes. I hope everyone is enjoying their Sunday.
Yes. So we thought this, being a Sunday, all the time we are working and we are busy with family and with work, but Sunday we can give to ourselves and we can talk about our transformation. So that's why I thought I should
True.
invite you and understand about this cosmetic surgery. Because, being a layman and being a
Sure.
normal person, non-medical person, cosmetic surgery, when it comes in the mind, a lot of, queries comes in the mind, how it happens,
Misconceptions. Yeah. Yeah.
why it is necessary, and what are the side effects, so many things. Even me being a medical person, but because I'm a cardiographer, I know much about heart. I am also having a lot of
Yeah.
questions, so I thought it's a good
Sure. Sure.
opportunity to take one by one all the questions with you.
Yeah. Sure, ma'am. Please go ahead.
So, ma'am,
Yes.
first of all, you please introduce yourself. I know about you, but I want to hear from you, from where you have studied, where you are working, what is your work experience and all.
Sure. I have done my MBBS from St. GS Medical College and KEM Hospital, which is one of the best hospitals in India. And after that, I did my master's in general surgery from Krishna Hospital in Karad, and then my super specialization in plastic surgery from Dinanath Mangeshkar Hospital in Pune. Thereafter, I also did a specialized fellowship, which was more focused on aesthetic surgery. So, for that, I had to travel to Spain and I worked with some of the best surgeons in the world for the same. After that, I traveled even to Sweden for gaining experience in aesthetic surgery. And I did a 1 year fellowship in New Zealand after that for specializing in other fields like microsurgery and hand surgery. And after coming back, I've been practicing with Wockhardt hospitals for quite some time now. And my core specialty and my special interest is more in aesthetic surgery. So that is one which we have been developing over the last few years. And the kind of procedures that we do involve the face as well as the body. We do a lot of facial aesthetic procedures like facelifts, like rhinoplasties, blepharoplasty, lip procedures, lip reduction, lip augmentation, neck lift, double chin reduction. So these are for the face. For the body, we are dealing with liposuction of various parts of the body, then breast augmentation, breast reduction, breast lift, tummy tuck, thigh lift, and as well as for arms, we are doing arm lift, arm liposuction. So that is how we are covering the entire spectrum of aesthetic surgery. Aesthetics is a very upcoming field. There are various new applications, various innovations which are taking place very rapidly. So, and it is also getting safer over a period of time. So, I would say if you have anything in mind, just I think it might
Yeah,
just be
sure, sure.
possible for you. Yeah, yeah.
Yes. I have seen the flyer. We are focusing on five major procedures: BBL and breast reduction, everything about the breast reduction, enlargement, uplift, and then rhinoplasty, tummy tuck, and liposuction. So one by one, I want to understand how it happens. What is tummy tuck, and is it invasive, non-invasive? How safe it is? How much time it takes? So one by one, we will take it.
Yeah, so I'll
Let's start
begin
with
with
tummy tuck.
liposuction because that is I'll start
Okay.
with lipo because that is one of the commonest things that we do. So basically, liposuction is a minimally invasive procedure. What we do is we focus on certain fat pockets of your body. For example, it could be the bra rolls or the love handles. It could be the buttocks. It could be the thighs, arms, or the tummy in general. And the given should be that the skin in that area should be elastic. So when we do liposuction, we infiltrate some fluid in that area to melt the fat, and then through tiny cannulae we extract the fat mechanically. So this fat is permanently removed from your body from that particular area, and the skin remains over there only. So we are not removing any of the skin. We are not doing any cutting of the skin. We are just removing the fat from that area. So now the skin has to
So it's
contract.
possible.
Yeah, so that is the requirement basically that the skin should be elastic in that area. It shouldn't be post weight loss. You know, after massive weight loss, the skin becomes loose. So that requires something else. But if there is a lot of elasticity of skin and we do liposuction, we allow wearing of a pressure garment. So that gives eventually a good contour of the skin because the skin contracts. So that is liposuction.
Mhm.
So that involves removal of fat from certain areas of our body. Now there is a innovation in which when we remove the fat, we can use that fat which we have removed for enhancing certain areas as well. For example, the butts. So we can give a good shape to the butts and we can give a butt lift. This
So it
usually is
is
done,
the
yeah.
same fat what you have taken out from my sagging skin, from my tummy. You will inject the same fat in buttocks. It's possible.
Yes, exactly. So basically,
Okay.
if we want an hourglass contour of the buttocks and the waist, we can narrow the waist by removing fat from the waist, and we can inject that same fat into the buttocks. So that eventually gives an enhanced hourglass shape to the body. So that is Brazilian butt lift. Same way we can use that fat for enhancing even the breasts. So we can use fat grafting for the breasts as well. We can use the fat for enhancement of the face also. For example, if there are hollows under the eyes or if there is prominence of the nasolabial folds, then we can use that fat for improving these lines and hollowness as well. So this is how we can use the same fat and enhance some other areas as well. So that and none of this involves any major cutting or any major incisions on the body. So there are no marks left, and the recovery is very quick. usually it requires an overnight stay in the hospital, and post the procedure, you need to wear that pressure garment for about 6 to 8 weeks, but you are up and about in 2 to 3 days. So you're back to your regular routine or back to your work in 2 to 3 days. Then the garment and your routine takes care of the rest of the things.
Okay. I have heard about liposuction and I have heard about liposuction 360-degree. What exactly that is? Can you please mention?
Yeah, so that is
Liposuction 360.
basically 360 degrees. So basically, it's all around. So we don't do just the liposuction of the tummy. We also do the liposuction of the sides and we do it on the back as well. So that is basically a 360-degree liposuction. So that will eventually give an all-round better contour and there'll be more inch loss in that case.
Okay.
Usually we combine it with tummy tuck. So when we are doing a tummy tuck, plus there is some excess fat in the love handles and the bra rolls, then we go for a 360-degree liposuction first, and then we do a tummy tuck as well. So that eventually gives a better contour to the body.
Okay. Good to know about it.
Yeah. So
Okay.
now we can speak
So
about
tummy
what
tuck
is
you
tummy tuck. Yes, yeah.
yes.
So, tummy tuck is for various indications. Now, there is not just excess of fat in the abdomen, but there is a lot of loose skin also. So, when does this happen? This typically happens after pregnancy, or it can happen after weight loss. That there is not just fat, but also very loose skin, like a hanging panniculus in the abdomen. So, this will not go with any kind of diet, exercise, any routine. Sometimes, because of the pregnancy, there is stretching of the muscles of the abdomen, and that causes the separation of the muscles of the abdomen. That is called as rectal diastasis, and that also eventually gives a very protruded belly appearance. Even if the
Mm-hmm.
our patient is thin, still they may have a protruded belly post pregnancy because of this rectal diastasis. So what we do in our tummy tuck is we make a bikini incision and we lift the skin, which is in the lower abdomen. We mobilize the skin, we separate it from the underlying muscles, and we tighten the muscles which have become weak because of the pregnancy. We remove all the excess skin in the lower abdomen and pull it down so that the tummy becomes completely flat. And the umbilicus is also transposed. So the original umbilicus is preserved and it is transposed into the new skin. So that eventually gives a better looking umbilicus also, and the added advantage in this case is if you have a lot of stretch marks in your lower abdomen or even the scar of pregnancy because of the C-section scar, so that can even be taken care of during a tummy tuck surgery. So that eventually gives a much better contour. This is also functionally helpful in certain patients because of the protruded abdomen. They are having back pain issues because the center of gravity has changed, or they are having hygiene issues. They are not being able to even access the genital parts because of the overhanging panniculus. So all those functional problems can also be taken care of when we are doing a tummy tuck. Now, the recovery period in this is a little more as compared to liposuction surgery because there is a cut involved in the lower abdomen. But it is not as much as a typical abdominal surgery because we are not cutting any muscles over here. So, usually, I would say a 1 week rest post surgery is advisable. You need to wear a pressure garment up for about 6 to 8 weeks, just like in liposuction also after tummy tuck surgery. And I would say after 1 week to 10 days, you can get back to your normal routine, your job. You would be advised to not to lift weights or go to the gym or do vigorous exercises for about a month's time post the surgery.
But
So
later whole
these are
life
the,
you can,
yeah.
but lifelong you can have a healthy lifestyle. You can lift things, you can
Yes,
run, everything.
absolutely. Absolutely. So
Okay.
after a month, once your healing is complete, your muscles have healed completely, your stitches have healed, you are feeling fine. You can go to your gym and you can lift weights. Like
Okay.
a few of my patients have actually uh, got so inspired after their tummy tuck that they have become heavy gymmers and they
Oh,
have developed even better contour. They have maintained it so well after the surgery, that they have developed even better contour after undergoing the surgery. So actually, sometimes there is a little bit of reluctancy initially because of the current shape of your body to go to the gym. So once you get a better shape, you are inspired to maintain that shape as well. So that gives a positive inspiration, yeah, a positive
I do
motivation
understand
as well. Yeah.
sometimes, yeah, sometimes surgery is the only option because I've seen, even me myself, if you want to get rid of something, small fat or small portion, if going to gym, it's a long time you have to go and you have to be very consistent, very regular, even though it's sometimes it becomes very hard to get rid of that. So maybe in that case, cosmetic surgery becomes one of the, choice we can opt for.
Yeah, one of the added
So,
advantage is that the what we have seen is once the fat content of your body decreases, it also improves the metabolism of your body. So that eventually also helps you in your functionality, like in your stamina, in your energy levels, in your daily routine. So you become more active after you have lost that weight. And that
ma'am,
also again motivates you to maintain it and even further reduce your weight. So that is one of the things which we have seen with our patients as well.
one thing I would like to ask, like after any of the cosmetic surgery, do we have to take regular medication lifelong?
No, no,
No,
no
nothing like that.
supplements as such or anything is required. Yeah.
Okay. And the undergarment you were mentioning in between that after the surgery you have to wear a particular type of undergarments. Is it for some duration or some period of time or
Yes.
uh, okay? Then after that, after
No,
a
that
month or
is
2 months, we can
usually
stop.
it is for 6 to 8 weeks. So I would say maximum period of 2 months. So basically, why do
Okay.
we need that? Now we have removed the fat from the under the surface of the skin, and there is muscle underneath. So we need the skin to stick to the underlying muscle. Okay. Now,
Okay.
when we use this compression garment, it makes sure that the skin and the underlying muscle are in close contact. Otherwise, there can be collection of fluid between the skin and the underlying muscle. So there are these chances of seroma formation, irregularity. So for best results, it is always better to wear the garment all the time.
Okay, okay, that's good to know.
Yeah.
Okay, so these cosmetic surgeries you have talked about tummy tuck, you have talked about liposuction. So for this hospital stays overnight, only one night you have to stay in the hospital. This is what you
For
mentioned, yes?
liposuction and for BBL liposuction, the stay is overnight. For breast reduction, the stay would be for 2 days because we put in drains as well. And for tummy
Okay,
tuck, it is about 3 to 4 days.
okay. So breast reduction. Okay, let's talk about breast now. Breast reduction and breast enlargement. How you do that in a layman
Yes,
language,
yeah.
like not a medical
Yes, yes. Yes, yeah,
terminology.
absolutely. Yeah, so who is a good candidate for a breast augmentation? Now, this would be any girl who has completed her pubertal age group. She has completed the puberty. She is about above 18 to 21 years of age, above that age, and she may be having hypoplasia of the breast. So what that means is, as compared to the rest of your body, your breasts are comparatively smaller. This can also happen because of certain congenital problems, like there is no growth of the breast at all. There can be asymmetry of the breast. So there one breast is bigger, one breast is smaller, one breast is better developed, one breast is not developed. So all these are all conditions for doing breast augmentation or breast enhancement. So how do we do this breast enhancement? This is done by use of either implants, that is a silicone implant, or with the help of fat grafting, or with the help of both implant and fat grafting. Usually, when we do implant-based augmentation, we do a consultation. We have to measure the height, we have to measure the base of your breast and the width of your chest, and then accordingly, we decide which is the perfect size of implant for you. Now, these implants are also of various shapes and sizes. They can be round, they can be teardrop shaped as well. Most of the time, we use round implants. And these round implants can be of various volumes, and there can be various projection levels as well as various width. So depending on the chest wall, we decide which is the ideal based implant for this patient. So usually, if we have to do an implant for any of our patients in the surgical camp, we would want to have a video consultation in which we explain the procedure thoroughly, and then accordingly we'll be carrying the implants with us when we are planning for this surgery. So implants are then inserted through a small incision which is taken under the surface of the breast. So this is not visible easily. It's under the surface, so it is not visible. And the recovery is quite quick. So again, this is also an overnight stay which is required. But the recovery is within 3 to 4 days, our patients are back to their normal routine. They are advised to wear a sport support bra or a sports bra for about a month's time, and then they can go back to their regular bras as well, or buy new bras according to the new size of the breast. So that is how we do a breast augmentation with implants. Now with fat grafting, as I had mentioned before, we can use the fat from which we have extracted from the tummy or from the thighs, and then inject this fat into the breast area. Now there is a limitation to how much fat we can inject into the breast, because some amount of the fat that we are injecting is always going to get absorbed by the body. So usually we overcorrect, but usually we advise the fat grafting only for patients who require a subtle increase in the breast size. So if they want to go from a B cup to a C cup, then that is possible for with the help of fat grafting. But it is not possible from A cup to C cup. So we cannot put in a lot of fat in one go, because that fat will eventually get completely absorbed and we'll have no results. So that is one thing which we should know. It is only for a subtle improvement. And sometimes we do both implant as well as grafting to give a more natural contour to the body. So that is about breast augmentation. Then for breast reduction, who are the
One thing
candidates?
is,
Yes.
one thing before we move further, breast augmentation, either we use silicone or the fat of your own body. Is it it's a minimal invasive or just a injectable things? How you are going to do that?
Yeah, so the breast implant, it requires a cut under the breast. It is a surgery which is done under general anesthesia. The implant is inserted under your breast gland, or it is inserted under the muscle, depending on how thick your breast is. So that is decided,
Okay.
but it is not a major surgery. The recovery is quite quick in even in these patients.
Okay.
And breast reduction, I would say, is a comparatively major surgery, because it involves an anchor-shaped incision or a lollipop-shaped incision, which we take around the nipple areola. And a maximum, it depends on how much breast is to be removed as well. So that is one of the indication why we need to do breast reduction. So I would discuss about the indications why we are doing a breast reduction. So it can be done in any age group. It can be done even in a younger patient if they are suffering with heavy breasts. If it is causing them neck pain, back pain, or it is causing this bra strap grooving, or even fungal infections in the skin crease under the breast, and the lot of sweating, and basically limited functioning. So if that is a cause, there is a lot of functional problems or the social stigma which is happening because of the large breast, then one should go for breast reduction. It is a very satisfying surgery. There is a lot of literal burden of the chest. We have removed from about 3 kgs from per breast also at times. So it has been a huge relief for certain patients. And it gives them an opportunity to go back to their normal life. So that is one of the indication if there is heavy breast. Also, if patient is having a lot of sagginess of the breast, not just heaviness, but lot of sagginess that can happen post pregnancy. It can happen in even in older age group, 50s, 60s also. And because of the sagginess, they are having difficulty in their daily routines. That can also be reduced by breast reduction. So this will involve a anchor shaped or a lollipop shaped cut around the breast, and the breast is lifted up. It gives a lifted, it gives an enhanced, it looks a better aesthetic result also. So usually the results are quite gratifying for all our patients. And
I
when we
personally
do
know
this,
two or three.
yeah,
I personally know two or three people. We will know. I will not say patients. They are the person they wanted to
yeah,
get rid of big breast. They have gone for breast reduction. And one of the patient, my
right, right.
patient from Tanzania, she went to you, and she met me
Yeah, yeah, yeah,
last week, and she was very much happy, very much satisfied, because earlier she
right, right.
got the spine pain because of heavy breast.
Yeah, yeah,
All the time is like this, and she was getting a lot of pain, and she was avoiding a lot of activities because of this thing. But now she
true,
is very
true.
much happy, satisfied, confident, and she was thanking to you, and
Yeah, thank you.
she was praising a lot for you.
Yeah.
Actually, I just wanted to convey this to you at this moment.
Yeah, thank
So
you.
it's a good thing
Yeah, so
to
actually
know.
it can be a very satisfying surgery. And so the side effect in this can be that if you plan to go for breastfeeding at a later stage, there can be a possibility that you may not be able to breastfeed. So that is
Oh,
one thing which you should explain to our patients that this is a possibility, but the chances are again 50-50 because we are preserving some amount of the breast, some amount of the breast is removed. So there may be a possibility, but it should always be explained to our patients. Yeah. If it is a
okay.
younger unmarried
In
female,
case of
yes, yeah.
yeah, in case of breast reduction, you are saying it can be the 50-50, but in breast augmentation, breastfeeding
There
is
is no
okay
problem at
after
all.
that?
Yeah, because we are
There
not
is no
touching the
problem.
glands at all. Yes, yes, yeah. So there
Okay,
is
and
no
breast uplift,
cut around. Yeah. In the
and
breast
those who are
lift,
doing only the breast uplift, for them.
yeah, in that also there is no possibility of a decrease in the breastfeeding because we are
Okay,
not removing any breast tissue. We are just removing the skin and we are doing internal lifting of the breast. So there is no interference with the gland of as such. Yeah.
okay, okay, good to know. So
Yeah.
this quite safe procedure, yes.
Yes, yes, yeah. So breast reduction usually requires 2 days stay. We keep in some drains to make sure that there is no blood collection or anything. And again, we need to use the support bra for about 6 to 8 weeks after the surgery. Usually, the recovery is also quite good. In 2 to 3 days, you are back to your regular routine. But if you have to take a leave from work, I would say 1 week leave should be sufficient. And then you
Okay,
can go back to your regular routine. Yeah,
not many days. Okay, so we
yeah.
have talked about four procedures. The last procedure I would like to talk now, BBL, Brazilian butt lift. First of all, I am very much curious to know why we said Brazilian butt lift. Why the word Brazilian used in this BBL?
Yeah, yeah, because the procedure was
If you can enlighten
popularized
us.
in Brazil, and I think the Latinas are known for their butts, and they really like those enhanced butts. And I think even the African
Okay.
women they do like the enhanced butts. So
Yes.
it started there, and then it has just taken up the name. So, but basically, it involves a non-surgical. I would say a minimally invasive, not involving any cutting, enhancement of the
Okay.
buttocks with the help of fat. So the fat which is taken from
Okay.
the waist, from the abdomen or from the thighs is then injected into the superficial compartment of the breast, sorry, of the buttocks, and that gives a more well enhanced and hourglass shape to the woman. So the procedure is again doesn't involve any major cuts. It is involving liposuction and injection of fat. And post the procedure, one needs to wear a pressure garment again to maintain the shape of the buttocks. One needs to avoid sleeping on the buttocks. You'll have to sleep on the tummy for at least 3 to 4 weeks continuously, and then gradually you can go back. And you will have to use a donut shaped pillow also to prevent any pressure on the operated area. So these are the
Okay,
precautions which
good.
you would need to take. Yeah.
Okay. So, and also, like, I'm coming across nowadays the patients who who are asking the queries. So, some of the patients say, okay, we are going for breast reduction. Can we do the same time our facelift or something double chin? So, these two, three procedures can be, can we can make a combo of two, three procedures. We can, like, you are coming here and we all are
Yeah,
excited
yeah.
to meet you. And, patients have two or three problems. They don't want to wait for your next
Yeah,
visit.
yeah.
So they want to do it
True,
in
true,
one
true.
go.
Yeah.
Is it possible?
Yeah. So, yes, it is possible. So, if you are planning for, suppose, a chin liposuction and a breast reduction, so that can be combined together. It can be done in the same sitting. But if it's a longer surgery, for example, if you are doing liposuction of the back along with breast lift and then facial surgery, that is a longer surgery. So, we would break it down into two, and we can do the body surgeries first, and then we can plan for the facial surgeries as a second step. That can be done in about 2 to 3 days time as well. So that is how it
So
depends on the
means
time
if you are here
duration.
for
We wouldn't
if you are
want
here for
somebody
three
to.
to 4 days, that can be covered.
Yes, yes, yeah. We wouldn't want somebody to be under anesthesia for a very long time. Plus, we want to make sure everything is safe. What we are doing is safe. We want to make sure that you are fit for the surgery. So, obviously, we'll be doing the test beforehand to make sure that you are fit, anesthesia wise, cardiac fitness, everything is there. But also, we don't want to increase any risk of any complications by increasing the duration of surgery. So, whatever is possible in a shorter duration, that would be done.
Okay, that's great to know.
Yeah.
So I think from my side, all the questions have covered, and I just wanted to understand there is no side effect, and we can live a normal, healthy life after all these procedures. Yes.
Yes, yes, yeah. So the bottom line here is basically what I would want to highlight is cosmetic surgery is a very perception-based surgery. It is not an objective-based surgery. It is very subjective. So
Okay.
I need to understand what are the expectations from the patient. That is one. You need to have the right set of expectations. It would always be advantageous if you go through, get some research done before you are committing to any surgery. See some videos, see how the patients have recovered from their surgeries. Some, live examples, if they take, that is always helpful because we don't want somebody to commit and then regret it later on. So it is always better to do your research before you are committing to a surgery. And once you are ready, we would obviously be doing a full disclosure of what are the pros and cons of any surgery because our priority is that you should be absolutely safe. This is a quality of life surgery. We don't want to decrease your quality of life, we want to enhance it. So that would be our number one priority that you have to be absolutely safe and you have to be eventually happy after the surgery. In case if there are any,
Yes.
smaller things, minor details which need to be taken care of post the surgery, so we'll be having our plastic surgery team from the hospital where we are operating. So they will be able to help you out. So that is one of the advantages that we are getting, that we are coming to the country and doing it. So that advantage is there that we have a backup and they will take care of anything else that is required after we have done the surgery. And obviously, we will always be there on video to help you, support you throughout your recovery course. So don't worry about what will happen to me after the surgery is done.
Okay, that's good to know.
All right.
So any questions from viewers? Let me check. But I did not receive any questions, but the appreciations only. People are saying very informative, very interesting. Of course, it's an interesting, interesting talk. Even me, I was confused at how it happens, how you do the BBL. BBL, like if it's Brazilian button lift. I was not knowing it can be done without the surgery. There is no invasive things. It is good to know about it
Right, right,
now.
yeah.
So it becomes
True,
always
true,
a
yeah.
taboo that okay, we are doing cosmetic surgery. What will happen? So many things in the mind because
True,
people
true,
are
true,
living
yeah.
life without this also. They want to do it, but again
True,
there is
true.
always a question mark: we should do it or not. So after I think listening um, those who want to do it, they will be more clear about the thoughts.
True, true, yeah.
Yes,
Okay.
thank you, madam.
It was
Any
nice
any
talking to
other
you
things
as
you would
well.
like to, any other things you
Yeah,
would
I
like to
think
share before we
Yeah, I think if anybody has any doubts, they can definitely put it in the comment box, and in the coming days, we would be happy to answer any of your queries. We're always there to answer questions. We like
so
doing that. Before the surgery is always better to ask questions and answer the questions. I like
yes.
people who ask questions. Yeah.
They have rights to ask. Okay, and one
Yes, yes.
let's in the end of the session, let's do a small takeaway. Those who have just joined us, they can understand. We are Dr. Shradha Deshpande. She is coming for a cosmetic surgical camp here in Tanzania on 13th May in Mlogenzila Hospital. The camp is going to be 3 days. At this moment, we have decided 3 days. But if we get more appointment, of course, she will extend her stay, and we love her to stay here to see more and more patients. We are focusing five procedures at this moment: tummy tuck, BBL, liposuction, and breast reduction, enlargement, and uplift, and rhinoplasty. And these all procedures, Dr. Shraddha told, these are safe. Most of the procedure needs only one night stay in the hospital, and then after that, 3 or 4 days uh, rest. Yeah, that's it, ma'am. And only the breast reduction
Yeah.
needs three to 4 days. Okay.
Yeah. And tummy
So
tuck
these all
needs
procedures are
about one
minimal,
week's rest. Yeah.
1 week's
Sure.
rest. These all procedures are
Yeah.
minimal invasive.
Yes, yes,
Okay,
yeah.
and we will. What I was thinking, it will be very big procedure. There will be lot. It was in my mind. Good, you have explained well. It
Sure.
was. I was
Yeah.
thinking like it BBL must be something like it will be a very big surgery. We are going to put so much skin grafting, lot of dressing. You have to remove
Oh
all the
my
parts. Then
God.
you will. It
Yeah.
was in my mind. Now
No,
I got to know it is.
no.
There is not at all a
Yeah,
surgery
yeah.
involved. So it's a maybe I can think of. Okay,
Sure.
that's a good conversation, ma'am. Thank you very much for joining us
Sure.
on
Lovely
MedINCREDI,
talking to
and
you.
looking forward.
Yes.
Same here.
Yes.
Looking forward to
Sure.
see you here soon. And
Sure. Me too.
Karibu sana,
Sure. Yeah.
Asante.
Thank you.
Okay,
Thank
thank
you.
you, ma'am. Good day. So everyone, now time to say bye. I hope all the queries will be taken care of. I have asked several questions, keeping in mind my audience what will be thinking about that. So I hope I have covered all the questions. But in case any questions arise in your mind, you can leave in the comment or you can WhatsApp me. My number is always there, and we would like to help you with all the informations what you are looking for. Thank you very much. Have a good day. Wish you best of your day and healthy life. Good day.